What we call this disease conditions? One-sided diseases. We studied, na? So, one-sided diseases are difficult and incurable cases. Along with this, the diseases with alternating symptoms. That is, at one time this symptom, at one time these symptoms. These are also difficult to treat. Along with this, the mixed miasmatic diseases. When there is a mixing of miasmatic diseases, it is also difficult to treat. Then, along with this, there is a artificial diseases, that is artificial morphic diseases, or what we call it as a diseases that are caused due to the allopathic drugs or the complications of allopathic drugs. Then the diseases having a gross pathology. These all are the diseases which are difficult to treat, or these are the incurable diseases. So, from this para, doctor can explain about the difficult and incurable cases. And in this, he firstly explain about, that is closely analogous to these cases are what may be called as alternating complaints and one-sided complaints. Those that show but one side. It is not uncommon for a patient's malady to have two sides, one side being manifested when the other side is not. So, in this, he explained one example, that is regarding the eye symptom and regarding the stomach symptom. That is, patient having one time with a eye symptom present, that is, eye symptom may be present when the stomach symptoms are absent. That is, at one time patient having a eye symptom and at the other time patient having a stomach symptoms. So what to do in that cases? So in that case he explained about, that is, you may find that euphrasia is more sharply related to eye symptom than the antisoric that fits the whole case. That is, now patients comes with only eye symptoms. In that case, you may prescribe the euphrasia without prescribing any antisoric medicine, as in your hand there is no total case or generals present. So at that time you prescribe the euphrasia that is more sharply related to the eye symptom than the any other antisoric medicine. And at the other time, that is the pulsatilla fits the stomach symptom. Then at the next time patient comes to you with a stomach symptoms, and at that time you prescribe the pulsatilla, which fits much better than the antisoric that fits the whole case. But remember that there is one antisoric that is more similar to the whole patients than these special remedies, because it is better fitted to the generals. But at one time euphrasia, at other time pulsatilla, but along with this there is a one remedy, that is antisoric remedy, that fits the all the symptoms of a uh, that is of that patient, that is that antisoric remedy. And in that it is because it is better fitted to the generals, as this remedy covers all the generals of that patient. So but when patient comes to you with one symptom, that is only eye symptoms, at that time you cannot recognize that what antisoric you have to prescribe. So at that time you prescribe the euphrasia. At next time when patient comes with only the stomach symptoms, at that time you prescribe the pulsatilla. But when patient comes to you for number of times and you prescribe the remedy, at that time you may have a knowledge that that is patient having the eye symptom, patient having the stomach symptoms, and patient having that much generals. That is, when patient comes to you for a number of times, then you can recognize that the patient may require this antisoric medicine. So this is the importance of that number of coming of a patients. Then the oftener you prescribe for different group of symptoms, the worse it is for your patients, because it tends to revise the constitutional state upon the patients and to make him incurable. But at the same time you prescribe a number of a medicine that may hamper the constitution of a patient and that makes him incurable. So do not prescribe until you have found a clear in your mind that one remedy may be more similar to the particular group of symptoms and another remedy to another group. Very often, a remedy that will go to the very center and restore order of the to the economy will cause quite a turmoil. These alternating and one-sided complaints are sometimes dreadful to manage, and when everything is thrown to the surface or the extremities, that is when gouty and the rheumatic symptoms have an outward tendency, the patient will run off and leaves you. So in that cases, that is when you prescribe for a number of time, that will change the constitution and that will make the case incurable. So in that cases, you have to not to prescribe the remedy at every time. You have to wait and watch. You have to understand the patient properly and you have to select a one antisoric medicine for this constitution. Otherwise the patient becomes incurable or that case becomes the incurable. So in this, doctor can give one example, that is when gouty and the rheumatic symptoms have an outward tendency, the patient will run off and leave you. That is when the patient having a severe, that is progression of disease condition, at that time the patient run off or leave the you, that is he will uh, run off from your treatment or he leave your clinic. So incurable complaints and you meet many will trouble any physician. The allopath has the means of putting the patients under the influence of strong drugs and making them imagine that something is being done to their benefit, whereas injury is being done whenever they are patched up by strong drugs. It is uncountable, therefore, that some of our homeopathic practitioners make use of palliatives that are so detrimental to the patient. So, in that case, they explain about, that is the incurable complaints. The incurable complaints and what you meet many will trouble any physician. That is when there are incurable troubles that will incurable complaints that troubles the physician. The allopath has means of putting the patients under the influence of strong drugs. So in that cases, what allopath done? The allopath puts the patient on a strong drugs and making them imagine that something is being done for their benefits, and they do something, that is they making them imagine that something is doing for their benefit, whereas injury is being done where whenever they are patched by strong drugs, but this is not for the benefit of the patient, but it makes the patients more injured by these strong drugs, and it is uncountable, therefore that some of our homeopathic practitioners make use of palliatives that are so detrimental to the patient. So in that cases, our homeopathic practitioners may use some palliative treatment. And what is the palliative treatment used by the homeopathic physician is better than the what is used by the allopathic physicians. So the physician who applies the single remedy in a potentized form under the law of cure any length of time will easily be convinced that there is no other way of palliation that holds out any permanent hope for the patient. That is, he explained one example regarding this, that is, the physician who applies the single remedy in potentized form under the law of cure any length of time will easily be convinced and that there is no other way of palliation that holds out any permanent hope for the patient. That is, opium will sometimes relieve pain, stop diarrhea, and medicate cough, but to the patient, it is so annulus reaction that there is no possible development of the symptoms that are necessary to indicate that the homeopathic remedy the patient needs, and while the pain is stopped, the patient is not cured. What has been said of opium is as true of all the drugs given to relieve pain When an opiate must be given, let it be clearly understood that cure of this patient is abundant, but a thoughtful physician will the hope of cure during painful sickness so long as life endures. In consumptions and cancers are wasting sickness, the remedy that is most similar to the painful group of symptoms will ever give the most relief, and it is forlorn hope that tempts its abundant. So in that para, it is explained about that is where the case is incurable. In that case, you have to use the medicine, but that medicine only palliate the disease condition and it will not suppress that disease condition. That is means it is not go inside or there should not be the development of a disease progress. So in that cases where the difficult and incurable cases you find, in that case you may palliate that cases. So this is the chapter number 37 that is explained by Dr. Kent in Kent's philosophy. Now what is the theme of this? That is what are the difficult and incurable cases. It is explained with references of aphorism number 74, 75, 172, 173 and 186. And in this the difficult and incurable cases are first one, that is the one-sided diseases. So what is the one-sided diseases? It is explained in 172 and 173. That is diseases having too few symptoms are known as one-sided diseases, and they are so termed because they display only one or two principal symptoms which obscure almost all others. They belong chiefly to the class of chronic diseases. Due to the death of the symptoms, they are less amiable to cure. That is, they having only few symptoms, so these are very difficult to cure. So this belong chiefly to the class of chronic diseases, but due to the lack of symptoms they are very difficult, or at some times they becomes the incurable cases. So this is the first, that is one sided diseases. Then second is the diseases with alternating symptoms. So what are the diseases with alternating symptoms? That is the symptoms which alternate with one another. That is Noxomica produces dry and fluent cough, coryza alternately. Then causative stools of pressing out of a rectum alternate with diarrheic stools, that is in bryonia. Then constipation alternates with diarrhea, that is in abrotanum. So these are the some of the diseases or the symptoms that alternate with one another. That is when we prescribe the medicine for one symptoms, at next time you will see the another symptom. So in that case it is very necessary to understand what is the alternating symptoms and what remedy it indicates. So these are the second type, that is diseases with alternating symptoms. Then next is a mixed miasmatic diseases. So what is the mixed miasmatic diseases? Where there is a presence of two or more miasm at a one time in a body. That is that we call this as a mixed miasmatic diseases. That is, it may be a sauropsychosis, it may be saurosyphilitic, it may be a psychosyphilitic, or it may be sauropsychosyphilitic. These are the mixed miasmatic diseases, and where there is a mixed miasm present in a body, these are very difficult to treat, or at some time they become the incurable cases. Then the next is the allopathic drug complications. These are also very difficult to treat. So that we call it as a, some cases get so complicated by allopathic drugging that drugs cannot withdrawn from the patients without suffering a profound and a potentially fatal aggravation of symptoms that have been suppressed for years. Homeopaths should generally in such drug dependent patients that homeopathic treatment cannot help them. So when the patient is taking the allopathic drug from long time, at that time his disease condition becomes so complicated. At that time it is very difficult to treat that cases with homeopathic medicines. So these are the diseases which are very difficult to treat, and these are the incurable cases also, as this crude form of drugs makes the very pathological changes in the patient. So homeopaths should generally heal such drug dependent patients that homeopathic treatment cannot help them, as these are becomes the so incurable cases. Then the next is the disease condition having the gross pathology, where there is a gross pathological changes present. These are also very difficult cases, and these are the incurable cases. So in this, there are pathological conditions in which organic change stand in the way of homeopathic treatment, and this can be treated only through surgical interventions. There are some cases homeopaths generally consider incurable, because in such cases reversion to health is impossible. The disease process may have to far advanced for homeopathic remedies to do more than provide palliation. By watching the direction and the progress of symptoms after administration of a remedy. So in that cases, the homeopath will be able to determine the prognosis of such cases. In a case where there is a deep pathology, the patient experiences a short amelioration followed by an aggravation, and the homeopath may suspect that the case is incurable. So this is the observation, that is the fifth observation, in which the patient having a short amelioration followed by an aggravation. So in that case, the homeopath may suspect that the case is incurable due to the gross pathological changes present in a patient. So even if after administration of a correctly selected medicine, the homeopathic aggravation continues for a very long period and the general condition of the patient continues to deteriorate, it indicates that the case is incurable. That is when you prescribe the medicine, that medicine gives the homeopathic aggravation, and that homeopathic aggravation continues for a long time, and the general condition of the patient continues to deteriorate, and it indicates that the case is incurable. Then another factor is very quick and short administration just after application of a well selected medicine followed by aggravation. This may happen if the selection of medicine is based only on a few symptoms instead of covering his symptoms totality. But if it occurs in spite of all the similarity of totality, including the causative factor, the case should be considered as incurable. So this is the indication of sixth observation of Dr. Kent. This is often observed in disease like cancer. That is, the amelioration is so short and it is followed by the aggravation. Then the another kind of disease or the patients that may be homeopathically incurable is the serious psychotic cases in which the patient has been an antipsychotic medication for a number of years. Although George Witholkas reports success in a few such cases in which he undertook treatment, he generally advises homeopaths not to accept such long-standing psychotic cases. So these are also the cases which are very difficult to treat, that is the psychotic cases. That is, it is not the psychosis, it is the psychotic, means psychotic, psychotic cases. That is, it is related to the mental disorder, that is the psychotic cases. Then it may also happen that the amelioration after the homeopathic aggravation does not persist for a period which is usually expected. For example, after the administration of a medicine, the period of amelioration is expected to be a month or two, but it actually lasts only 8 to 10 days, and the previous symptoms reappear and are aggravated. Then the case should be deemed as incurable provided no obstacle to cure exists. So in that all difficult and incurable cases, if after a well selected medicine the symptoms follow a path contrary to Hering's law of cure, it should be considered that the vital principle is very low and it is attempting to palliate only the superficial symptoms. The inference is that yes, Abhishek, can you listen?
Oh, ma'am.
Okay. The last part is remaining only. That is, after this,
मी
yes, you are alone. I know that.
ओके ठीक आहे चालेल ना.
Okay, we will end the topic. After this, there is another lecture.
हो हो ठीक ठीक आहे.
So, if after a well selected medicine the symptoms follow path contrary to Hering's law of cure, it should be considered that the vital principle is at a very low, and so it is attempting to palliate only the superficial symptoms. So, when we select some medicine for these cases, that is for the incurable or the difficult cases, in that cases we found that it do not follow the Hering's law of cure, and when it is not follow the Hering's law of cure, we may think that the vital principle is at very low, that is the vital force is very weak of that patient due to that incurable or the difficult cases, and at that time there occurs only the palliation of these cases, as there is palliation of only superficial symptoms, that is what are the superficial symptoms that gets palliated, and the medicine not acting to that much deep level, as due to these cases are very difficult or the incurable cases. As incurable cases, there is only the palliation of these symptoms, and the inference is that an important internal organ will be destroyed. In case of removal of some spleen, kidney by surgery, or cirrhosis of liver due to alcoholism, rendering the case incurable. So why this becomes the incurable, or why their vital principle is becomes so weak? That is, there is the removal of some organs, that is like a spleen, kidney, or there is a cirrhosis of liver due to alcoholism. As due to these deep pathological or gross changes, the vital principle becomes so weak, and so there is not a permanent cure possible. So in these incurable cases, there is only the palliation of superficial symptoms, and that will help the patient to for some degree, that is there is a helping for a patient for some degree, as we can make only the palliation of these cases. So this is the difficult and incurable cases that is explained by Dr. Kent, and in this you have to remember that which are the difficult and incurable cases. That is the one sided diseases, diseases having the alternating symptoms. Then the third one, that is the mixed miasmatic diseases. Fourth one, that is diseases that is complicated with allopathic treatment. And fifth one, that is the diseases having a gross pathological changes. These are the difficult and the incurable cases, and in that cases we can only make the use of only palliation, that is only the superficial symptoms get palliated, and in some degree we can give relief to the patient. So this is regarding the chapter number 37, that is difficult and incurable cases, which is treated by the way of palliation. And in this way we finished the topic palliation. So up till now we finished the topic, that is from topic number 23, the examination of the patient, up to the 37. All these topics we cover. Along with this we also covered the indispositions, and so I think half of the topics we covers from Kant's philosophy. Yes, we cover
Yes, ma'am.
idiosyncrasy, individualization, characteristics, value of symptoms, second prescription, homeopathic aggravation, Kant's 12 observation, and lastly the difficult and incurable cases. So in next lecture we'll took some another topic, that is the previous topics we remove remaining, the last topics we covered. So in next lecture we will take the another topic from Kant's philosophy. I think all of you understanding, and if any difficulty you can ask anytime. So we will stop here and end the meeting. Someone please send me attendance. ओके. यस, कोणाला काय विचारायचं आहे?